name is Dr. Maurice Pitesky, and welcome back to the Sitch. This is episode number 12 of our bi-monthly show from the UC Davis School of Veterinary Medicine Cooperative Extension. So today we're going to give a warm welcome to the worms that may live inside your chickens. So let's open up that can of worms on worms. Okay, so that was my last of my impeccable puns. Seriously, that was it. So first of all, I'm bound by my no fancy word pledge that I gave in episode number 1. So I will not be saying words like ascarids and capillaria and oocysts. Instead, I'll just be saying the generic term worm. But it's important to appreciate that there are different types of worms and that each type may cause different clinical signs and may require different types of treatments. So some basics on worms. If you have chickens, you have worms that live inside your chickens, and that's totally okay. When it's not okay is if you see worms in the feces or the eggs or even the mouth. It's also a problem if your chicken is having associated problems such as being emaciated, having some diarrhea, things like that. In general, worms don't kill chickens. They're typically just parasites, but high infestations can result in death. As I alluded to before, there are a bunch of different types of worms, but for our purposes, we're only going to talk about roundworms, capillary worms, and tapeworms. Those are the biggies. Roundworms are typically the most common type of worm that are found in backyard poultry. They are whitish, yellowish in color and are long, anywhere from 1/2 inch to 3 inches long, so you can see them, by about 1/8 inch wide. They live in the intestines, and if there's a lot of them, you'll definitely see them in the feces. The next one are capillary worms, which are like hair-like worms. You can still see them, but much smaller. They're found in the crop or the esophagus. So the crop is a little little pouch type thing, or thickening kind of in the throat area of your chicken's neck. Tapeworms are the last one we're going to talk about, and those are long, white, flattened, ribbon-shaped worms composed of numerous segments that also live in the intestines. They can even grow longer than roundworms, and you can definitely see those in the feces. Before we talk about potential treatments, I do want to kind of stress prevention, since prevention is always better than treatment and much less expensive than treatment. While worms and their eggs will always be present at some level within the poultry environment, you can mitigate their ability to cause disease with proper husbandry and management. I really want you to focus on that if you do have worm issues or you want to prevent them in the first place. In general, control measures should be focused on sanitation, which will disrupt the worm's life cycle. So focus on good husbandry and biosecurity. For example, infected chickens and avian wildlife will poop out worms and their eggs, which then can be subsequently ingested by your uninfected chickens, or they can be transmitted into insects and snails, which can then be ingested by uninfected chickens. So getting rid of anything that doesn't belong in your coop, aside from your chickens, is going to be in your best interests. Treatment, when it comes to treatment, and using dewormers, there are two general schools of thought. Some doctors will advocate for annual or even biannual treatments using various dewormers such as Safeguard, piperazine, and hygromycin. Others, like myself, encourage owners to only treat if they notice associated clinical signs such as worms in the feces and or their birds are emaciated. This method reduces the potential drug resistance that can come from just treating giving medications kind of willy-nilly without any indication to use them. From my perspective, we want to move away from using drugs we don't have to use, whether they be antibiotics or dewormers. Alternatively, if you're a worrywart, you can just you can work with your vet. You can bring them a fresh poop sample, and they can look at the worm burden in the feces and make an appropriate decision from there. Two drugs to be aware of for treatment of worms is a drug called Safeguard, which has the active ingredient fenbendazole in it. That works typically against roundworms, tapeworms, cecal worms, which we didn't talk about, and hygromycin, which is also effective primarily against roundworms. There are other drugs that do work, but remember, chickens are considered, no matter what you do with them, they're considered food animals, and therefore you have to be very careful to make sure when we give them a drug that its residues don't end up in the eggs or meat. If you have any question on this really important topic, with respect to what medications you can and can't use, you can go to the Food Animal Residue Avoidance Databank's website, or farad.org. They have great information. They also have contact information, so you can reach out to some great resources across the country. In summary, chickens often have worms. So use good poultry, use good husbandry and biosecurity to reduce the worm burden, and only treat if necessary with an approved drug. I hope this was helpful, and as always, if there are any topics you would like covered on the Sitch, please reach out to me at drcluck@ucdavis.edu. Thanks.